bill to broaden the FDA's oversight on compounding pharmacies, making it easier for the federal government to track prescription drugs from manufacturers to pharmacies. The Senate will later recess at 12:30 p.m. for their weekly party conferences. Live coverage here on C-SPAN 2.
The Senate will come to order. The chaplain, retired Admiral Barry Black, will lead the Senate in prayer.
Let us pray. Spirit of God, descend on our hearts, for apart from you, life is sound and fury, signifying nothing. May our senators walk in your ways, keeping your precepts with such integrity that they will never be ashamed. Lord, incline their hearts to your wisdom, providing them with the understanding they need to accomplish your purposes in our world. Let your mercy protect them from the dangers of this life as they learn to find delight in your commandments. Keep them ever mindful of the fewness of their days and the greatness of their work. We pray in your holy name. Amen.
Please join me in reciting the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Mr. President.
The Majority Leader.
Mr. President, I want, before my esteemed senior senator from Vermont leaves the floor, just say a word. I so appreciate your guidance and leadership over these many years of leading the Judiciary Committee. It's a committee where most all the legislation is funneled, and what we focused on in recent months is the problem we have with judges. I appreciate your leadership. Yesterday you did a remarkably good job in leading a press event indicating the issues that we have with the D.C. Circuit, and I so appreciate your leadership in this issue and all the other issues the Judiciary Committee works on. It's too bad that we can't have the Judiciary Committee as it was in our earlier years in the Senate, where the productivity of that committee is not thwarted by not being able to bring things to the floor. The wide-ranging jurisdiction of the Judiciary Committee is so important to our country. Issues dealing with things going on with our national security agencies, cybersecurity, just the multitude of issues the committee deals with. And I wish that we could be doing more legislation here on the floor that comes from that committee. So I want to extend my appreciation to the presiding officer for the good work that is done, and certainly the accolades that I want to send to the people of Vermont for having this good man leading the Senate in many different ways, not the least of which is being the presiding officer of the Senate today as a President pro tem. Mr. President, the symptoms of fungal meningitis can be very subtle at first. Headache, fever, even light can start bothering you, and neck aches, back aches. But the disease can also cause strokes, seizures, and even comas. This condition, fungal meningitis, led to the death of at least 64 unfortunate Americans who were exposed to fungal meningitis when they were injected with contaminated medicine. The medicine, a steroid injection used to heal back pain, was tainted by unsanitary conditions at a facility that was masquerading as a compounding pharmacy in Massachusetts. True compounding pharmacies provide custom-made medications for patients with unique health needs that cannot be treated by off-the-shelf prescription medicines. This practice is essential and can be critical for children, cancer patients, and people with severe allergies. But contaminated medicine mixed at the New England Compounding Center was sent to scores of medical facilities in 23 different states, and it was given to 14,000 patients. As I've indicated, 64 of them died, and hundreds of them were made very, very seriously ill. And, Mr. President, recently, heart medication mixed at this same pharmacy was linked to the death of 2 young Nevada boys aged 4 and 6, according to a lawsuit filed by their parents. The New England Compounding Center was skirting federal regulation and manufacturing large batches of drugs for mass distribution and in very, very unsanitary conditions. By avoiding the safety inspections required of large-scale drug manufacturers, companies like this can boost profits, but in the process they risk lives. The legislation on the floor will end that dangerous practice and ensure that patients have access to high-quality custom medications. Mr. President, this is not a contentious issue. On the contrary, this legislation enjoys broad, bipartisan support, led by Senators Harkin and Alexander. It would pass by a wide margin in mere moments, not for stall tactics of a few Republican senators. Yet this bill has already been delayed for more than a month because of these tactics, and Republicans continue to insist that we run out the clock on this matter. Just so everyone knows, if all the time is required on the procedural issues, we will not be able to finish the bill until this Sunday. That is working Saturday, and the final 30 hours wouldn't run out until sometime on Sunday. It's time to dispense with this non-controversial measure, this life-saving measure. It'll safeguard the lives of Americans, vulnerable Americans, people with back pain and other maladies, and move on to other important legislative priorities.
Mr. President.
The Republican leader.
One of the favorite pastimes of politicians in Washington is to talk about how frustrated the American people are with politicians in Washington. After the past few weeks, it's easy to see why. I'm talking about the President's promise, repeated dozens of times, that if you like your health care plan, you can keep it. And the sobering realization by literally millions of Americans that it just wasn't true. Some of the top fact checkers in the country have used terms like pants on fire and false and Pinocchios to describe the claim that under Obamacare folks would be able to keep their plans. In a matter of weeks, it's gone from being one of the law's top selling points to a national punchline. And if millions of people weren't so frustrated and upset by it, it might actually be funny. But it's not the least bit funny. At this stage, about 50,000 folks are believed to have signed up for insurance on the federal exchange, way, way below administration estimates. That's 50,000 who've signed up for insurance on the exchange, while 3.5 million Americans have lost their health care coverage. In other words, about twice as many folks have lost their insurance in the state of Idaho alone since October 1st as have obtained health insurance across the entire federal exchange all across America. So this is a real crisis. In my home state of Kentucky, over 250,000 people have lost their private health care plans so far and only about 7,000 Kentuckians have been able to obtain new private insurance under Obamacare. If you consider that Kentucky received $250 million in taxpayer funds to get Obamacare up and running, the state of Kentucky got $250 million in taxpayer funds to get Obamacare up and running. That works out to about $35,000 per private insurance enrollee. $35,000 per private insurance enrollee. And that's before the taxpayer subsidies kick in. So we've thrown literally untold millions at this disastrous rollout. And what do we have to show for it? Millions of people losing their coverage, despite assurances from the president they'd be able to keep it. He said they'd be able to keep it, period. That's what the president said. So let's be very clear about something. These insurance cancellations are not any kind of an accident. This is no accident. It's the way the law was designed. Remember, in order for Obamacare to work, millions of Americans had to lose the coverage they had purchased on their own so the government could dump them into the Obamacare exchanges. That way, the government could then get them to pay more to subsidize coverage for everybody else. That's the way this thing was designed to work. The 31-year-old dentist from Louisville I mentioned last week, the one who isn't married and has no kids, but now has to carry pediatric dental care on his plan, well, he's one of the unfortunate ones who's now subsidizing care for everybody else. And despite the fact that the president and the other supporters of the bill vowed up and down that folks like this would be able to keep the health care plans they had and liked, the fact is that was never true. It was never true, and they knew it. They knew folks would lose their coverage. They knew it all along. Just as the president once famously predicted that utility rates would necessarily skyrocket as a result of his cap-and-trade policy, so too would health care rates skyrocket under Obamacare. The only difference is that on health care, Democrats apparently knew they couldn't tell people how it would all shake out in the end. But they knew. That's why in 2010, every Democrat who was in the Senate voted against a Republican proposal designed to hold the president to his word. Back in 2010, every Democrat in the Senate voted against a proposal to hold the president to his word. The fact is, the president's health care law was designed to capture millions of middle-class Americans, jack up their premiums, and use the extra cash to keep Obamacare afloat. This isn't some unforeseen consequence of the law. It is the law. It's working just like they designed it, just like what they voted for. So it's hard to take seriously this faux outrage we've seen of late from some of our Democratic friends. And as for the president, well, this should be no great revelation to him either. Just the other day, the media pointed out that the administration knew for years, that Americans would lose coverage. But there's something else. At a bipartisan health care summit in 2010, the president was asked directly about this kind of thing by House Majority Leader Cantor. In reply, the president admitted that 8 to 10 million would have to change coverage, and then justified it on grounds that they'd be getting better coverage from the government once they lost it. So the president actually admitted during that event that millions would lose their health care, and still went out on the campaign trail claiming Americans could keep the health care plans they had. This is why Americans feel so hurt by this particular broken promise. And what many of them want to know is this: why would Washington Democrats persist with it even after it became clear it was false? I think the reasons are simple enough. One, they needed to pass the Obamacare bill. And two, they needed to sell it to a skeptical public. And neither would have been possible without it. If the president had gone out and told people that if he likes your plan, you can keep it, If the President had said, if he likes your plan, you can keep it, it would have never passed. And that's why the President's so-called apology of the night rang so hollow for so many. Obamacare's problems run so deep and the broken promises are so pervasive that it's impossible to identify an easy fix. It truly ought to be repealed or delayed. But if the President is sorry for breaking his promise to the American people, there is a natural place to start. He could support legislation that would help restore the plans for the folks who want them back. And he can act on it as early as this Friday. That's because the House is expected to send over a bill that would allow Americans to keep the plans they have and want to keep. There's no reason the President and Senate Democrats should not join Republicans and the American people in supporting it. This doesn't have to be a partisan battle. These cancellations haven't discriminated based on party. The people out there who are frustrated and upset at losing their health care plans are Democrats and Republicans. The President can help all of them by backing the bill the House is expected to pass on Friday. I think that's basically what President Clinton was suggesting yesterday when he said the President should honor the commitment the government made to these folks, even, said Bill Clinton, if it means changing the law. I've had a lot of disagreements with President Clinton over the years, but at key moments he was willing to cross party lines, and I think here's a moment where the American people are expecting President Obama to do the same. Allowing Americans to keep their health plans is a promise Democrats made over and over and over again. Whether or not they meant it, Democrats promised this to the American people, and it's their duty to make good on what they said. Once the House acts, my conference will be watching closely to see whether the Senate Democratic majority allows a vote and will help us send a bill to the President's desk. The American people will be watching closely as well. So my message to the President is simple. Mr. President, our constituents are frustrated and they're upset. You could help. Do the right thing. And briefly on another matter, Ford Motor Company has a proud 100-year history of manufacturing in Kentucky. Today, the company announces a new model to be constructed in its Louisville assembly plant, further employing yet another generation of Kentuckians. I'd like to congratulate Ford on this development and applaud its continued excellence in manufacturing in the Commonwealth of Kentucky. Mr. President, I yield the floor.
Under the previous order, the leadership time is reserved. Under the previous order, the Senate will be in a period of morning business for 1 hour, with senators permitted to speak therein for up to 10 minutes each, with the time equally divided and controlled between the two leaders or their designees, with the majority controlling the first half.
Mr. President.
The senator from Indiana.
Thank you, Mr. President. And I would like to congratulate my friend from Kentucky on Ford's expansion there. We have a proud auto building history in Indiana as well. We're extraordinarily proud of all the different folks who help make our country run, who help make our cars go. And in Indiana, it is part of who we are, and it's great to see expansion in Kentucky as well. Mr. President, I am here today to discuss the most important issue facing Hoosiers and all Americans, and that's getting a good job. Good jobs allow us to provide for our loved ones, educate our children, and ultimately retire with dignity. Good jobs are also critical for strong communities and a vibrant economy. That's why I'm proud to be part of the group of senators working on manufacturing jobs for America. It's an effort to refocus the Senate on helping businesses create jobs and help communities pursue economic development in the area of manufacturing. This effort is aimed at building bipartisan support for modernizing the manufacturing sector, increasing access to capital, strengthening our workforce, and creating the conditions necessary for American manufacturers to grow and create jobs. I have two bills as a part of this effort. the Skills Gap Strategy Act and the America Works Act. Both of them are focused on closing the skills gap. There are an estimated 600,000 manufacturing jobs that are unfilled across our country, in part because employers can't find workers with the skills they need to fill these open jobs. We need to match up unemployed or underemployed Americans with the training and education programs employers need so that we can get more Americans into these good-paying, skilled jobs. Last month, my friend Senator Dean Heller and I introduced the Skills Gap Strategy Act. This directs the Department of Labor to develop a goal-oriented strategy to address the skills gap challenges we have. In order for every Hoosier who wants a job to have a job, and for Indiana's economy to continue to grow, we must train Hoosiers for the jobs that are available right now. Our bill examines how we can better use existing resources to prioritize training and education programs and prepare our workforce to hit the ground running on day one. The Skills Gap Strategy Act requires the Department of Labor to provide recommendations on increasing on-the-job training and apprenticeship opportunities, helping employers participate more in education and workforce training, and identifying and prioritizing in-demand credentials in existing and emerging industries. When completing this report, we call on the Department to consider specific labor barriers contributing to the skills gap, policies that have proven successful in key industries, regions, and countries where employers play a larger role in education and workforce training, and ways to better utilize registered apprenticeship and other workforce development programs. We are also asking the Department of Labor to develop plans with the Departments of Commerce and Education to align education with industry and enhance employer participation in K-12 and career and technical education programs, to increase pre-apprenticeship and college credit courses in secondary schools, and to improve school-to-work transitions and connections. I'm a strong believer in being fiscally responsible with Hoosier taxpayer dollars. That's why our bill asks the Department of Labor to focus on these solutions that use existing resources, existing programs, and existing personnel, not new programs or new spending. Closing the skills gap requires participation from individual workers, from the education community, and employers. But we have the ability to help, and a specific plan should be in place to do just that. Also, a part of the Manufacturing Jobs for America effort is another bill I'm proud to support that focuses on closing the skills gap. Introduced by Senators Hagan and Heller and myself, the America Works Act modifies existing federal training programs so that they place a priority on programs and certifications that are recognized and demanded by industry. I've heard time after time from Hoosier business owners and educators and workers about the pressing need to close the skills gap and to get more people to work. To address this issue, while not increasing federal spending, the America Works Act modifies the Workforce Investment Act, Perkins Career and Technical Education, and Trade Adjustment Assistance to prioritize the credentials that employers need now. The improvements made in this bill benefit both workers and employers, as workers know that the time they spend training is more likely to lead to employment in a good-paying job. And employers know that it's more likely that the people they hire have the training they need to get the job done on day one. Mr. President, the Department of Labor estimates there are nearly 4 million job openings in the United States, despite an unemployment rate that is still over 7%, and despite millions of Americans looking for work. Now is the time to get to work on these jobs and match these people up with the job opportunities that are available out there. That's the most important thing we can be doing. When Americans are working, we're a stronger nation. the Manufacturing Jobs for America effort to pass bipartisan legislation that everyone can buy into that helps manufacturers and workers is one important way we can move the ball ahead. Mr. President, I yield back the balance of my time. And I note the absence of a quorum.
The clerk will call the roll.
Mr. Alexander.
The Senate is in a quorum call. They will resume work at 11 a.m. on a bill giving the FDA oversight over pharmacies that sell compound drugs. No votes for today have yet been announced. Members will recess between 12:30 and 2:15 for party lunches. And during this morning's quorum calls, we'll show you some of the hearing taking place in the Senate Homeland Security Committee. They're holding a confirmation hearing for Jay Johnson to be the new Department of Homeland Security Secretary, and we'll go to that now.
But my hope is that you will, in fact, renew your commitment to the committee and to me personally, that you will run a transparent shop, being responsive to us and our concerns, not only giving us an opportunity to have education from you on what the facts really are, but also to receive information in turn on what we're seeing in the respective areas across the country. There's too much at stake for us not to work together to fix the Department of Homeland Security. As Senator Carper noted, morale is at the lowest level by the surveys done by OPM of any department within the federal government. That's a function of leadership, and I think you have those qualities to instill that, to rebuild this organization, and to put it in a place where it needs to be. The American people are counting on us, but they're going to be counting on you. And there's simply too much at stake for us to fail. I hope that you will earn this committee's trust. You have earned mine thus far. And I look forward to working with you in this very important job.
Before we say to my colleagues, as we know on this committee, we work under the early bird rule, and after the chair and the ranking member have given statements, we turn to the witnesses to testify, and then we recognize the members in order as they've come in to ask questions. Ms. McCaskill was the next one here, and Senator Tester, Senator Heitkamp, followed by Senator McCain. Others will come as well. I just want to say just a quick follow-up to Tom's comments. We take seriously the opportunity to engage with you and really to understand you better as a human being and your priorities and really your values. and how they were developed and your approach to managing a big department like this. I just want to say thank you for your willingness to meet with all of us who serve on this committee. I understand you've tried to meet with Senator Paul and I think Senator Portman and have not been able to get onto their schedules yet, but I appreciate you trying. I hope you'll continue to do that. I'm sure you will. We also thank you. I'm told by our staff, bipartisan staff, that you spent some 2 hours or more in meeting with them privately and answering, as I'm told, every question that they ask. And you stayed till last man or woman standing and answered all their questions. Some very well, maybe some not so well. And you wouldn't expect you to know everything, that's for sure. We'll have the opportunity today to ask you questions, and we'll stay here basically till we run out of questions and you run out of endurance. And I don't think it'll take too long. But if you would, I think it's not uncommon I think you had over 100 questions to answer, and a lot of those questions are multi-part. Some of those questions I don't expect you to be able to answer, and it's not surprising you wouldn't rely on, to some extent, on the folks who are at the department and their job is to help nominees. I would just ask that you go back through the information that the questions that Dr. Coburn is going to send to you. Go through them and edit them. Just mark them up and give them back to him promptly, and we can move forward. Senator McCaskill has to run, and I'm going to ask you if my colleagues don't mind, just to let her go out of order. And if you would just go ahead and
Thank you so much. I really appreciate it,
glad you're here.
Chairman. I'll just take a minute. I actually have to leave, Mr. Johnson, to go to the outside panel.
Dispensing with the reading of the roll.
Without objection.
And I ask to be recognized for up to 10 minutes in morning business.
The senator is recognized.
I thank the chair. I want to begin by thanking Chairman Harkin, Ranking Member Alexander, Senators Franken and Roberts, and all of their staffs for their tremendous leadership on this bill. This bill was also developed in concert with our counterparts in the House of Representatives. And I extend my thanks to Ranking Member Henry Waxman and Chairman Fred Upton and their staffs of the Energy and Commerce Committee. What we have now is a bipartisan, bicameral bill that addresses two very serious issues: the safety of compounded drugs and the security of our entire drug supply. Last fall, an outbreak of fungal meningitis stunned the nation and thus far has claimed the lives of 64 people and sickened 751 in 20 states. This issue hits home for me because it started in Massachusetts. At the center of this tragedy was the New England Compounding Center, also known as NECC, and it was located in Framingham, Massachusetts. I met some of these victims of this terrible outbreak and heard about their struggles, like Jerry Cohen, a resident of Pikesville, Maryland, who went to the doctor for routine steroid injections to treat recurring back pain and received 2 doses that came from the contaminated lots. Jerry suffered a stroke and had to adjust to a new life, dealing with dizziness, nausea, weakness, and exhaustion. Or Melanie Norwood, whose mother, Marjorie, went into a Tennessee hospital to treat an acute back injury she suffered while mowing the lawn. Instead of walking out of the hospital, Marjorie instead became severely sick, spent months in the hospital and a nursing home, and now has permanent nerve damage and medical bills that are close to putting her into bankruptcy. For the last decade, complaints about sterility, safety, lack of valid prescriptions, and mass production of drugs have been lodged against NECC. Yet the company was allowed to continue operating largely unchecked, falling between the regulatory cracks that exist between federal oversight of drug manufacturers and state oversight of pharmacies. And sadly, NECC was not an isolated instance. Almost a year ago, I issued a report detailing more than a decade of violations and problems at compounding pharmacies all across our nation. Contaminated IV solutions, tainted steroid injections and fouled eye drops permanently impacted thousands of patients' lives across this country and killed or injured dozens across 34 states. The New England Compounding Center, like many large compounding facilities, fell into a regulatory black hole. That's because there are two kinds of compounding pharmacies. The neighborhood pharmacist you've known and trusted for years, and the large drug manufacturers operating in the shadows that have slipped through the regulatory cracks. Traditional compounding pharmacies make custom medications that fit the needs of an individual patient, such as creating a liquid medication instead of a pill for an elderly patient or a child because it is easier to swallow. We're familiar with that corner store pharmacist who does that for a patient. These pharmacies are an important tool in our medical arsenal and have historically fallen under the jurisdiction of the states. They're the corner pharmacies that people grew up with. They're the corner pharmacies that people trust. But there has been a recent disturbing trend of larger compounding pharmacies entering the market, making high-risk drugs sold to hospitals and clinics throughout the country. These compounding facilities are operating more as modern-day drug manufacturers rather than the mortar and pestle compounders of yesteryear on the corner near your home. They're not Main Street, and they do most of their business out of sight and under the FDA's radar. In 1997, Congress passed a law to define FDA's role in the oversight of compounding pharmacies. But just 2 days before the new law was to take effect, 7 compounding pharmacies sued to block its enactment. Since then, the law and the FDA's authority to regulate compounding pharmacies have been mired in litigation and uncertainty. The result is that the oversight of even large-scale drug manufacturers like NECC has been largely relegated to the states. So how are the states doing their jobs? Well, last April, I issued an investigative report that took a deep look at how states actually oversee and govern the activities of compounding pharmacies. What I found was a regulatory state of disarray. My investigation found that nationwide, most state regulators don't look at the safety of compounding pharmacies. They don't make all their activities and investigations public. Some of them don't even know how many compounding pharmacies exist in their states. And states typically aren't equipped to regulate the safety of large companies, shipping massive quantities of drugs outside their own borders into states all across our country. Since the NECC outbreak, some states have made efforts to improve their regulations and guidelines over compounding pharmacies, but the results are not consistent. Within the last month, my home state of Massachusetts passed through its House and Senate a bill that I am proud to say will put in place the strongest state regulations in the country overseeing the compounding pharmacy industry. However, while Massachusetts has become a national leader in the oversight of compounding pharmacies in the aftermath of what happened at NECC, this does little to protect the residents of other states. And it can't protect residents of Massachusetts from drugs that are shipped in from other states that do not have strong safety standards in place. The Drug and Safety and Security Bill in front of us today helps to solve that problem by creating for the first time a national and uniform set of rules for compounding pharmacies that wish to register with the FDA and be subject to FDA oversight and enforcement. This bill also provides transparency by requiring the FDA to publish a list of the name and location of registered facilities that are compounding drugs in large quantities without a prescription. The Drug Safety and Security Act also mirrors several concepts from the valid Compounding Act of 2013, the legislation which I introduced into the House of Representatives. The bill distinguishes between compounders engaging in traditional pharmacy work from those making large volumes of compounded drugs without individual prescription. It places limits on the type and quality of ingredients that can be used to compound drugs. It ensures that drugs removed for the market for safety and effectiveness reasons are not compounded. The bill requires reporting of adverse events like patient sickness or hospitalizations that could be caused by compounding pharmacies that are registered with the FDA, and it provides more information on the labels of compounded drugs, including identification of the drug as being compounded, the first time ever that this information will be required. Because of this bill, for the first time ever, the FDA will know who these large sterile compounding entities are and what they are making. And the FDA will be given the resources it needs to conduct inspections of these facilities. And for the first time ever, hospitals and healthcare facilities will have the option of purchasing compounded drugs that are subject to rigorous FDA quality standards and oversight. And because this bill removes the legal ambiguities of existing law, compounding pharmacies will no longer fly under the radar. This bill will go a long way in ensuring that public health is protected and compounded drugs are safe. I'd like to specifically thank Chairman Harkin and his staff for including in this bill a provision which I authored requiring the GAO to examine whether states and federal authorities are doing their jobs to properly ensure the safety of compounded drugs. Congress needs to continue to keep a close eye on the FDA and this industry, holding them accountable for their new responsibilities. And this study will assist us in carrying out effective oversight of this new law. We need to ensure that a tragedy like the NECC meningitis outbreak is never repeated. With the passage of this drug safety and security bill today, we have a clear example of what Congress can accomplish when both sides come together in a bipartisan fashion. We can protect the public. We can hold industry to high but achievable standards. And we can support small businesses who have been doing the right thing for years. This is a very important historic piece of legislation. It goes right to the heart of what the Congress can do to make sure that when drugs are in interstate commerce, that we are protecting people, families, so that the health of their families are, in fact, being protected. That is the essence of what the Congress should be doing. It is a very good day when it is working to protect the people of our country. Today is one of those days. Throughout the course of this week, we are going to have a discussion about the role that the federal government has to play in ensuring that the drugs which families in our country use are, in fact, safe for their consumption, that the representations that are made are, in fact, accurate to those families. We cannot, again, see a rollback of the protections which did, in fact, happen in this area that, in fact, exposed families to the kinds of risks that generations ago were common within our country. It is a big day. It is a historic piece of legislation. I urge for its unanimous passage through this body, and I, Madam Chair, yield back the balance of my time. And Madam Chair, I doubt the presence of a quorum.
The clerk will call the roll. Mr. Alexander.
Madam President.
Senator from Missouri.
I move we initiate the quorum call.
Without objection.
Madam President, it's been less than 6 weeks since the President's health care initiative, the Affordable Care Act, was launched. The website's still not working, but the website will work. Actually, the website will be the easiest thing, in my view, that the administration will deal with as they try to solve the problems that are going to created by the act itself, and frankly, then the problems that are created by the website not working when we started. What we see happening already in this 6 weeks is that families are losing their current health care coverage. Certainly the cost, and example after example from my state of Missouri and across the country, appear to be going up at substantial levels for many families. A few families are lucky enough that they don't have much additional cost, but not very many. And a lot of families just simply are losing the coverage they've had, even though the President said, as we all have been reminded over and over again in recent days, if you like your health care plan, you can keep your health care plan. Apparently there are a whole lot of caveats on that weren't said at the time because people aren't able to keep their health care plan. The Associated Press reported that at least 3.5 million people have received cancellation notices. I heard somebody at the White House the other day said, well, these individual policies, that's only about 5% of all the people in the country. 5% of all the people in the country of millions and millions of people. And even if it wasn't millions of people, if you're one of the 3.5 million families that just were told your health care policy was canceled, 100% of your health care policies were canceled because you don't have one right now, or at least you're told you're not going to have one sometime between now and the end of the year. As millions of people are losing their plans, we find out that only a few thousand people have signed up. Reports apparently show that fewer than 50,000 people have been able to successfully get through this system in 6 weeks, a period where the estimate was 500,000 people. So far we have 50,000 people signing up, not 500,000 people. We have millions of people losing their plans, even though everybody was told if you like your plan, you'll be able to keep your plan. But it's estimated now that 7 million people were expected to get coverage by the end of March. Nobody any longer thinks that that's a number that will come anywhere close to being achieved. The American people obviously would like the President to figure out how to live up to the promise that you can keep the health care you have if you like it. A lot of people are weighing in. President Clinton, in the last day or so, has said he thinks we ought to figure out a way to keep the promise. Not a real reach. If this was not a promise just made one time and accidentally stated. This was a promise made over and over again. If you like your health care plan, you can keep it. If you like your doctor, you can keep your doctor. And we're finding that that's not true. So whether it's President Clinton who said we should figure out how to keep that promise, or there are all kinds of bills being filed in both the House and the Senate that would keep the promise. What I think we're going to find out is that there are lots of promises in the Affordable Care Act that aren't going to be kept. I think we already know that this has workplace impact that's not good. People going from full-time to part-time, people trying to keep their job numbers under 50 so they don't have to comply with the law. I've heard from many Missourians who have seen their hours reduced, who are seeing their health care premiums rise, seeing their options of insurance limited, their policies being canceled. They really deserve to have the people who've made this pledge now keep this pledge. The President, congressional Democrats who voted for the law, and there are very few laws you can say congressional Democrats who voted for the law, because this is a law that not a single Republican in the House or the Senate was for. And by the way, there were plenty of alternatives out there. High-risk pools would work better, medical liability reform, expanding the marketplace where you could buy across state lines, more reporting by health care providers of what they charge and what their results are. The idea that there was no other option that's widely repeated that people who don't want to go down the Affordable Health Care Act don't want to do anything. Just simply not true. When I was a member of the House of Representatives, I filed a handful of bills, none of which were more than 75 pages long, that would deal with these rifle shot things that would have made the best health care system in the world work better. Wasn't perfect, but it was the best health care system in the world, and I think we're in danger of losing that. The President promised Americans, if you like your doctor, you can keep your doctor. Over and over again, that's not the case. The largest insurer on the Missouri exchange, on the exchange that Missouri voters have access to, doesn't include the largest hospital system. That means that thousands of patients won't be able to see the doctors or to go to the 13 hospitals of the largest health care system from the company that was their likely provider. This was the largest insurer and is at this moment the largest insurer in our state, the largest health care system, not part of their plan. Your insurance company, your hospital, your longtime doctor, all should be your choice, not the choice of some government-dictated health care plan. With only one other insurer selling policies in the region where this big hospital system is, people just aren't going to be able to be there. Many states have this same problem. Many states have options that don't include many of their hospitals or many of their health care providers. And people are beginning to look at this and not just be concerned about a violated pledge, but being concerned about somebody besides them interfering with a long-term relationship with the hospital you go to, with the doctor you want to see. Patients across the country are seeing and are likely to continue to see narrower and narrower networks available to them as insurers will try to keep costs down. With all of the new mandates in the law, one of the things they can control is they can negotiate with the people that would be available to see patients under their plan. And that's obviously what is happening. Smaller networks can require patients to travel further. People driving by the doctor's office that they went to for years to get to the doctor that they now have to go to. People passing by the hospital that their family may have gone to for generations to get to the hospital that now is the only hospital in their area available under the exchange. This is going to become the routine for Americans who aren't going to be able to keep the insurance they like. They're not going to be able to keep the doctor they like. In many cases, they won't be able to go to the hospital they like. Last week, I told stories of several Missourians who had pre-existing conditions and are going to lose those policies when the Missouri high-risk pool goes out of existence. Another thing we suggested in 2009 was let's look for ways to expand the high-risk pools and make them work even better. They were working pretty well. The problem was there was always a waiting list of how to get into the high-risk pool. That was the way to deal with pre-existing conditions. We're in a state like ours where 4,300 people are on the high-risk pool. They pay about 135% of the normal premium. That's a little more than the normal premium, but they're getting insurance after they got sick, and this is a high-risk pool where that has to work 135% for somebody who didn't have insurance until they got sick or lost their insurance after they got sick. That was probably a whole lot better than they're going to do right now, and they're finding out it's a whole lot better than they're going to do right now. One of the things we received this week was from Pam in Oronogo, Missouri, which is just outside of Joplin. Pam says that her oldest son, Aaron, was born with a medical condition where there's a buildup of fluid inside his skull. He had his first shunt surgery at age 18 months. Her family has a family business and held on to their insurance through the business as long as they could because they knew that no one would insure Aaron if they lost it. Now, that's obviously not a situation we'd want to see perpetuated. Aaron, however, was ready to go to the high-risk pool. After 10 years, their premiums had increased to $2,000 a month with a $10,000 deductible, and so they were able to get Aaron in the high-risk pool, and they were reasonably comfortable with that. But now, with the elimination of the high-risk pool, all of which closed on December 31 in every state in the country. With the elimination of the high-risk pool, Pam and her family have to go to the exchange for Aaron. Now, the exchange has to take Aaron because you can get in the exchange with 2 more minutes. Unanimous consent?
Without objection.
Without getting in the exchange, even if you had a pre-existing condition. But what did they find in the exchange? They found that Aaron can no longer use his neurosurgeon from Kansas City, the surgeon he's used for years now. They can't buy a catastrophic policy that will allow them to have some choice and just pay some upfront cost on their own so they could have the doctor they're comfortable with. But they're where they are. The insurance they've had has gone away. The insurance they can get doesn't allow them to see the doctor that this young man has seen for years with a condition he's had his whole life. The President also promised that premiums would decrease, and that's just clearly not the case. So I look forward to Missourians continuing to let us know the challenges they're having. I look forward to being able to share those on the floor of the Senate in the next few weeks. One of my constituents of Independence, wife came home. Their policy that had been costing $500 a month now is going to cost $1,100 a month. She's the office manager of an office with about 20 employees. Their insurance more than doubled. Unfortunately, these cases aren't the only ones I could talk about today. They're not nearly as limited as we would hope they would be. And people are finding out that the Affordable Health Care Act that wasn't good for the workplace is now turning out not to be very good for health care. And I notice the absence of a quorum. Oh, I yield, my friend.
Madam President.
Senator from North Carolina.
Madam President, we've heard about horror stories. I want to talk about
the
another
Senate is in a quorum call? Oh, sorry.
I want to talk about another one, and it's the bill in front of the Senate today. It's the Drug Quality and Security Act. Today, the Senate has an important opportunity to advance balanced bipartisan legislation on behalf of our nation's patients. The Drug Quality and Security Act will respond to the tragic events surrounding last year's meningitis outbreak and will strengthen and improve our national pharmaceutical supply chain. Last year's unfortunate compounding meningitis outbreak has reminded us that had the early warning signs been heeded, we may have been able to prevent or mitigate the crisis in the first place. In light of what Congress has learned since the outbreak first occurred last fall, this bipartisan legislation includes provisions that respond to and take a big step towards addressing the issues which led to the unfortunate pharmaceutical compounding tragedy over 1 year ago. America's patients expect and deserve the peace of mind that medicines they take are safe and effective. FDA's repeated warnings of counterfeited drugs making their way into our prescription drug supply chain and the increased number of pharmaceutical thefts are the early warning signs of a potential and growing threat that could significantly compromise or endanger the health and well-being of patients across our nation. In recent years, states have responded by putting new requirements in place, but at a time when we should be working to lower the cost of health care, this increasing patchwork of state regulatory requirements is instead driving up the cost of health care in America. For more than a year, I've worked with Senator Michael Bennet and my colleagues on the Senate Health, Education, Labor, and Pensions Committee on bipartisan legislation to address these problems and to strengthen the safety, security, and accountability of our nation's pharmaceutical drug supply chain. The Drug Quality and Security Act, which we have before us today, includes provisions that will establish strong, uniform prescription drug tracing standards that reflect today's realities and ensures a safer and more secure pharmaceutical drug supply chain. The Drug Quality and Security Act establishes a uniform electronic unit level system over the next decade that will increase the security and ensure a safer pharmaceutical drug supply chain from manufacturers all the way to dispensers. This legislation will require trading partners to be authorized and to pass and receive information as part of their transactions. It raises the wholesale distribution licensing standard. It establishes licensure standards for third-party logistics providers and requires suspect and illegitimate products to be appropriately handled. I'd like to thank Chairman Harkin and Ranking Member Alexander for their leadership on this very important bipartisan bill. I'd especially like to recognize Senator Bennett, who has been a strong partner throughout the crafting of this legislation. For more than a year, we've worked together on this bipartisan legislation with our colleagues and have finally achieved an important balance with this bill. And I might add here, Madam President, we were told this couldn't be done. We were told this is too difficult. But for a year and a half, we have tackled this objective. Congress has the opportunity today to proactively put in place uniform workable standards that will allow stakeholders greater regulatory certainty and give patients the confidence they deserve in the safety and security of our nation's pharmaceutical drug supply chain. Congress's opportunity today are twofold, as this legislation is also a chance to respond to a crisis that impacted the lives of hundreds of patients nationwide. And I hope my colleagues will join me in supporting the Drug Quality and Security Act. Madam President, to follow up the conversations on today's bill, I've listened to my good friend Senator Blunt talk about Aaron, one of those Americans caught in the crosshairs of the Affordable Care Act and its unintended consequences. I was home this weekend. I was stopped by five individuals with practically the identical story. They came up and they said, Richard, I was covered. I had insurance. I have no pre-existing conditions, nor does anybody in my family. I had a $10,000 deductible insurance policy that cost me about $450 a month. And I had the security of knowing it was there. Well, I just got my new notice, and my insurance went to a $15,000 deductible, and my monthly premium's $1,440. These are five individuals, five different families, but with the similar story. And I think of the year-long debate that we had on the Affordable Care Act and the claims that were made. Reduce premiums, bring down health care costs, provide coverage for those that don't have it. Today, what do we see? Today's snapshot, and this may change, dysfunctional website, 5 million people who have been notified that they've lost their insurance, a very tepid enrollment of individuals. But I think what's gotten lost in the realities today are the hundreds of thousands of Americans that were like the five that came up to me this weekend. They're still getting insurance. Their deductible went up to $15,000. Their premium went up to $1,440 a month. Tell me where in that this is affordable. Tell me where in this process they got a better plan than they had before. Their deductible went up $5,000. That means the first $15,000 of their health care is coming right out of their pocket. And they're paying $1,440 a month to have the security of knowing there's insurance after that. Clearly, these are five Americans that would tell me this falls woefully short of the promise that was made to them. And I'd be willing to bet that in every state, in every House district around the country, we're going to continue to hear stories about this. Let me just say, we will, I'm sure, debate heavily where we move to from here. But don't forget, under this bill, now that we have extended the enrollment period to March 31st, that under the law, every insurer who bids to be in the exchange, starting April 1 of next year through April 27th, will have to submit their bids for 2015. Let me say that again. For every insurer that wants to be in the exchange, starting April 1 of next year through April 27th, they will have to submit their premium bids for 2015. They're going to do it having no experience with the pool of insured lives because we've extended till March 31st the enrollment. That's assuming that the website gets fixed. That assumes that people are going to enroll. And with little actuarial history, these insurance companies are going to have to bid for 2015. Imagine what the premium cost is going to be in 2015 when it's not 5% of the American people that are now in the exchange, it's 100%. It's all the employers that are impacted by 2015 prices. I've always been taught that there are signs that you should pay attention to. When 5 people come up to you and say, listen, my deductible went from $10,000 to $15,000, my premium went from $450 to $1,440, that's a warning sign. We ought to listen to it. We've still got a chance to fix, but most of it means, like Senator Blunt talked about, when you've got a high-risk pool in Missouri or North Carolina, keep the high-risk pool. We can manage it much better on a state level than we can to nationalize and do top-down health care in this country. Madam President, this won't be the end of the conversations on the Affordable Care Act. The American people deserve better than this, and this Congress must produce it. I yield the floor.
Madam President.
The senator from Indiana.
Madam President, there's an old expression used by many Hoosiers and others across America. It's time-tested. Your word